Are you too young for hormone replacement therapy? This is a question I commonly get asked, and I think it's because there's a lot of messaging out there that talks about hormone replacement therapy for women who are in menopause. And so what menopause is it's a day. It's 12 months without a period. The average age of menopause in North America is 51 years old. That's the average. That means that a woman could be 45 and menopausal, and that's very normal. Perimenopause happens 7 to 10 years before menopause, and perimenopause, it's a thing. It is a really potentially challenging time in a woman's life for a couple of reasons. Number one, our bodies are covered in estrogen receptors, and that's why your perimenopause experience is different than mine, which is different than hers. Mine might be really urinary tract related. I have a ton of symptoms, a ton of brain fog, I can't sleep. Whereas this person has a ton of joint pain, vaginal dryness, and night sweats. It could look different. And I think one of the challenges around perimenopause, which can happen 7 to 10 years before menopause, so a woman who's 45 could be menopausal at 45, could be having perimenopause at 35 years old. And I think a lot of people think you can't benefit or take HRT until you're menopausal, and that's simply not the case. If you are perimenopausal, you can benefit from menopausal doses of hormone replacement therapy. And there's lots of different options on how that looks, but you can take estrogen, progesterone, and testosterone in your perimenopausal period, because often the symptoms are debilitating. And if you are not feeling yourself, it is so important that you find support who can help you access hormone replacement therapy, because it's a myth that you have to wait till menopause. And so I just want you to know that. If a provider has told you, no, you cannot have hormone replacement therapy because you still have a period or you're not menopausal, that is simply not the case, and you deserve better support. So I want to start there. We'll leave that there for today. If you have questions about HRT, put it in the comments and let's start the discussion.